and welcome to Women's Football Hub. I am your host for this episode. I am Carolyn Kent, and with me today is a graduate in medicine from Cambridge University. She's an honorary clinical lecturer in the Division of Medicine at University College London. She's published multiple research papers and has been the author of Hormones, Health and Human Potential, and also the editor for the publication of the books Myths of Menopause. Welcome to Women's Football Hub, Dr. Nicky Keay.
Thank you very much for inviting me, Carolyn. I'm always excited and passionate talking about women's health and women's hormones, so I'm looking forward to this.
And I'm very looking forward to it too, because actually we've had quite a lot of traction with regards to, we're talking about hormones quite a bit, primarily in regards to the menstrual cycle. And then, of course, I've had some of the walking footballers coming through to me saying, hang on, what about menopause? I suppose question number one is, for those that are unfamiliar with menopause, what is it and how does it affect kind of female footballers?
Menopause is something that every single woman will experience during her lifetime. So absolutely, we should be talking about it. And what is it? It's effectively the time when the ovaries retire. So you've already mentioned, Carolyn, that we have menstrual cycles. Our periods typically start when we're 12 or so, and we have this regular fluctuation of hormones with periods. But then there comes a time the ovaries have been working really hard, they retire, and that's effectively what it is. What menopause is. Menopause means stopping of the periods. And the reason that the periods stop is because the ovaries retire and they no longer produce that fluctuation of hormones, that beautiful hormone choreography, and they no longer release the eggs every month. So menopause for the majority of women, it's a natural physiological event that will happen, average age 51, anything from 45 to 55. And yet it is a challenging time because your body, and you have got used to this fluctuation of hormones over your whole lifetime up to that point, and then suddenly that stops, the ovaries retire. So that's why it can be a bit of a challenge, and that's why absolutely we need to talk about it, because as I've said, every single woman will experience it. So we need to talk about it, because with the increased life expectancy, probably as women, we're going to live at least a third of our life without periods in menopause. We need to really talk about it, right?
So in that case, then, I think talking about it's absolutely crucial. And what are some of the key sort of physical and mental challenges that menopause presents then?
So the ovaries retire, like I said, at menopause, and that means they don't produce those amazing hormones. And hormones are super important for all aspects of our health, both mental and physical health. The word hormone actually derives from the ancient Greek meaning setting in motion, because the hormones direct the expression of DNA. So suddenly you haven't got estrogen and progesterone anymore driving the expression of DNA and making particular proteins. So yeah, can be a bit of a shock to the system. As I said, physically and mentally. Physically, for example, obviously your periods will change and ultimately stop, but also you can get like random aches and pains when you're not actually injured. And probably the top symptom of menopause is what we call vasomotor symptoms, which means hot flushes. I could be sitting here doing this interview with you, and then suddenly I come over a sweat, although I might today because I'm a little bit ill. But anyway, imagine that you're ill and you're really hot and sweaty. That's what it's like, one of these hot flushes. And it's really disconcerting because you don't know when it's going to come. And if it happens during night, then that disturbs your sleep. So that's another top one, disturbing your sleep. And we all know that if you have a bad night's sleep, it's just not great anyway. So you've got this double whammy of the sleep gets disrupted because the hormones are changing and you're getting hot flushes. So those are the things. So those are some of the top physical things. But in terms of mental aspects, psychological aspects, certainly mood can be very labile, fluctuating, and anxiety. That's something I notice actually, feeling anxious, feeling really low, sad, and on the other hand, flipping to feeling happy. It's just like really weird. It is a challenging time because if you didn't know that, why are you having all these symptoms? It's just like really weird. You think you're literally falling apart, but actually underpinning it is, of course, the change in the hormones. But again, recognizing that there's this underlying what's going on, this change, and this is why you're feeling like this, that in itself is really empowering, because you think, okay, fine, I'm not losing my mind. There's a reason for this, and you can do something about it.
And I think it's interesting, isn't it? Because I think the first thing is recognition and knowing what it is. And then I suppose the next thing then is, can coaches, clubs, players adapt training? Can they adapt, kind of have recovery programs? Is there anything there that might help them?
Just as for the younger athlete who is having a menstrual cycle and maybe, for example, has very heavy periods or has symptoms of PMS, premenstrual syndrome, then for those players, you're going to say, okay, fine, you need a bit more recovery in your luteal phase, for example, where possible. Like, I accept that you're training as a team, so it's a little bit difficult, but nevertheless, you can make little modifications for the individual, or the individual will be aware of that and just let the coach know, hey, I'm not so good today, I'm just going to go easy on this, so the coach won't be shouting and saying, what are you doing? So just as we do that for the younger woman with menstrual cycles, same for the menopausal woman. And by then she's wise enough, old enough, and so you have to respect. If she says, look, I'm not feeling, I had a really bad night's sleep and I'm just going to go a little bit easy today or whatever, then I think it's having that courage as an individual to articulate that to the coach. But if the coach is prepared that women and feels comfortable that the woman will come and say, she doesn't have to go into full details, but just say, look, I'm not feeling so good today, or whatever it is, depending on the relationship with the player, the athlete and the coach, then everyone's on the same page. But it's very much, I think there are two elements to this, Carolyn. I think, of course, it's the woman having that courage. Yes, go on, articulate it. It's fine. Every woman will experience this over their lifetime, and we're all slightly different. For some, it will be more challenging than others, all that sort of thing. But also the other part of this is the coach. The coach listening, and obviously we're not expecting coaches to be doctors, but just knowing if a woman says, look, I'm not so good today or something like this, then they're going to say, fine, support them in that.
And I think it's interesting because one of the things we hear from coaches, it's primarily male coaches who they understand now the impact of the menstrual cycle on their players, and they are uncomfortable sometimes talking about it. And the first question I ask them is, okay, why are you uncomfortable? Is it a lack of knowledge? Is it because it's taboo? Is it because, and I think them understanding that. So for coaches that are maybe like, oh, right, okay, you want me to talk about the menopause now, what advice do you give them with regards to either learning about it or how to either approach a player who's maybe not spoken about it or to deal with a player that comes to them about it?
I think to reassure the coach, like I said, we're not expecting the coaches to become medical doctors and make diagnoses or anything like this, but just having some fundamental information, idea, because lots of male coaches, by the way, will have daughters, wives, partners, female friends, and there's plenty of sources of information, not least my book, and this is menopause. The coach can go away and inform themselves, just as of course the coach informs himself about training methods and all that sort of thing. Almost, I would say, it's part of that being a really professional coach. You know about all your training methods, and you've done all your various examinations to be a coach and safeguarding, etc., etc. But actually, this is part of it. Just understanding, not in like super detail, but just a vague idea of what I've said. There's the menstrual cycle, hormones are going up and down. That's why the women can feel different during the menstrual cycle. As you say, we've made progress with that. And then all they need to know is that at some point, around about 50, this fluctuation of hormones will stop and the periods will stop. That's menopause. And this will have consequences on how the woman feels and her mental and physical health. That's literally, just keep it like simple like that. Just be listening. I suppose the tricky one is what happens if you are a coach and you suspect that the woman is in menopause, but she hasn't articulated that. You don't have to, I would suggest maybe you don't want to, obviously it depends how well you know the player. You probably don't want to go steaming in there and say, oh, you're menopausal, right? I wouldn't suggest that. But just touching, just going in and saying, how you doing? Just checking in. And then she might volunteer something to show that you have noticed as the coach and you are opening the door. If they want to, they can come and explain, or even if they don't use the word menopause, they might just want to, they appreciate that checking in. How are you? They say, actually, I'm really having a bad sleep. Doesn't have to mention necessarily the word menopause. And I might just, and then the coach will say, okay, that's fine. Don't worry. I understand. Make sure you're getting enough recovery and just keep me posted how you're going. So it doesn't have to be anything heavy duty, but just recognizing and opening up the conversation and letting the woman know it's okay. It's okay to say something.
Yeah, and I think certainly in my experience, I typically appreciate that when coaches do that, because I think it shows that empathy of them noticing that, are you okay? And I think that's a big thing of just remembering that your players are people.
Exactly.
They're not just robots to go through training. So let's chat about exercise, because one of the big things we get now, and I think there's been a real push, I think this is probably getting out there a little bit more, that strength and conditioning, lifting weights, and all these things are great for older women with regards to lots of different things. So what types of exercise in particular is beneficial for managing menopausal symptoms?
I think you're right. I will come to the strength training, but I think what's happened is it's become maybe so predominant. Everyone is thinking that it's only strength training, forget everything else. But actually, what it is all the types of fitness, cardiovascular fitness, muscular strength and endurance, proprioception, balance, by the way, really super important, and flexibility. These are all the things you have to bear in mind when you're doing your training, but definitely the emphasis changes more. So for the young athletes, this will be more on technical skills and whatever, not like really hard, high intensity. And for the older age group women, then of course you still need to do all the things, the cardiovascular, the balance, very important, all these things. But definitely the strength training does become more important, if I can put it like that. And the reason is because these hormones are changing, the ovarian hormones, but also there's another hormone I want to mention called growth hormone, which is an anabolic hormone. It builds muscle and bone, and men as well. By the way, that's the other thing about menopause. I think maybe it's taboo because also it is generally associated with being a little bit older. And we feel in our society, it's like, oh, being really old, that's not good. Men have a decline in growth hormone as well. So women have the decline in the ovarian hormones and decline in growth hormone. So unless you actively do something, you will be, at risk. You will lose muscle mass and bone mass. That's it, full stop. So you obviously want to do something proactive to prevent that. And this is where the strength training comes in. And you're right, if you are somebody that is already lifting weights and you want to progress, that's absolutely brilliant, go for it. If, I have to be honest, you're like me, and I hate that, right? You won't find me in a gym lifting weights anytime, I can assure you. So there are other ways. If you're thinking either you really don't fancy it or you're really out of practice, build it up gradually. There's an interesting paper saying doing body weight exercises can actually be pretty effective. Planks, all that sort of stuff. And we did a study a little time back and we put together just 20 minutes exercises you can do in your house, weighted lunges, planks, all this sort of stuff, a little bit of controlled jumping. So you can, strength training definitely, but what exactly that looks like will be very much for the individual. But what you are aiming for is definitely to do some, it's number one. And secondly, to try and progress it because the body reacts to change. So don't be satisfied that, oh, you can do 10 seconds plank or something. It's like 15 next time. Give yourself a little bit of a challenge and progress it. And where necessary, speak with others, speak with your coach so you have guidance, especially if you do want to start doing weights. Obviously, we don't want any injuries.
Yeah, and I think there's an element of that progressive overload, isn't there? And just
Yes, exactly.
seeing where you're at and trying to improve that a little bit more.
Yeah.
And I suppose the big question is, and this is something we get all the time, a lot of the players that certainly I'm seeing at walking football are busy, some working women, usually a time of high stress with regards to they might have now new carer responsibilities with regards to also caring for older parents.
Yep.
What do you ever have any advice for somebody who's like, how am I fitting this into my routine?
Yes, I think it would be what I've described. We put together 3 times a week, we recommended, and 20 minutes. And you just do it in your house. You don't need any fancy equipment. And literally it was planks, front plank, side plank. Even if you haven't got hand weights, cans of whatever, weighted lunges, some aeroplane balances, you can fit it in, honestly. And by the way, I'm speaking as somebody who really doesn't like doing strength training. I'll be absolutely honest. But if I can do it, you can, and you don't. If you have time to go to the gym and whatever, that's brilliant. But if you really don't, then doing something is better than nothing. And getting some resistance bands if you haven't invested. I've got one even on my table. There we go. Get some resistance bands, and those are really good for resistance, but also for stretching. You can loop that band over your leg and stretch. So put together your own little routine would be my advice. If you're really short of time, I totally understand it. You can do it.
And I think that's interesting because what we're basically saying is you don't need a fancy gym pass. You
No.
don't need something that you're paying for, some sort of subscription. You can actually just take these exercises and do them yourself. And I think from a physio perspective, one of the things we often use is what's called repetitions in reserve. So go to a point on that day where you could feel you could do just about 2 more and then stop it because that protects against injury, but also they've got the option to see how they are that day, especially if they've had issues with sleep, etc. So
Yep.
I think the other thing we need to talk about then is obviously the psychological impact of
Mm.
menopause, because a lot of the kind of stuff that comes out says maybe think about mindfulness, maybe think about meditation. What's your sort of views on those sorts of things?
Another thing I'm not very good at is that mindfulness, clearing your mind is anyway. But if you are somebody, I've got a colleague who has started doing it, and she was frankly a bit skeptical like me, and she actually swears by it and says it's really good. I think the key thing is whatever works for you. And when we do know that CBT, cognitive behavioral therapy, does help. It's from what I understand. I got a psychologist to write the particular chapter in the book, but so I don't want to go too much out of my area of expertise. But from what I understand is that it's going back to this idea of if you understand what's going on, you know you're having a hot flush because the hormones are changing and whatever, and it's just literally like mind over matter. So I think there is a place for this CBT. After all, it's not surprising, the brain, how we interpret stuff. We can be sitting in a traffic jam and we have a choice. We can either get really super stressed up and say, oh no, get out of the way, or we can say, it is what it is. There we go. I'm just going to put on some music. And so we do have a choice, I think. So that's my view of maybe not a sort of an official one, but of psychological. First thing is, don't say I am stressed. Say, I notice I'm feeling stressed, like I'm in the traffic jam. I could let myself get really like this, but you know what? I'm not going to. So I think just taking an active way in how you react to things can be helpful. And certainly CBT can help. And also other little things like if you're getting frustrated, journaling, writing some things down, what's happened in the day. Yeah, I did get stuck in the traffic jam or whatever, but I did get annoyed, but I'm not going to do that tomorrow. And what are my objectives for tomorrow? So there are lots of different tools you can use yourself. As I say, you don't have to have expensive appointments, all this sort of thing. Although CBT is a specialist thing, that would be via GP or whatever. But you can just take control of things, and just simple things like if you've got brain fog and you're forgetting stuff, that was me, make lots of lists, right? So just try and be practical with things and be realistic. If you make a list, these are all the things I've got to do today, and it's going on for pages and pages, you're just going to get frustrated, right? So prioritize. What do I absolutely have to do and what can wait? I think as women, you mentioned already, we're busy, we've got children, we've got older parents, I'm getting at us now. There's a lot of pulls on our time, but prioritizing time for you and prioritizing what you need to do, I think that already makes you feel calmer.
Yeah. And I think that's it. And I think it's also kind of just recognizing that there will be certain symptoms that you will have. And I suppose my question then comes as if there's anybody listening to this who thinks, I might be going through I might be in menopause. How would someone know? How would they get a diagnosis per se? What happens there?
If your periods are definitely stopped, if you're in that late 40s, early 50s, and you haven't had any periods, the strict definition of menopause is no periods for 12 months, for a year in that age group. So that's like a done and dusted. You're pretty sure you are menopause. But it's the lead up to menopause. It's the lead up to when the ovaries fully retire. The ovaries are going part-time, as I say. This is perimenopause, right? And it's really confusing. And I'm afraid to say, ladies, that the main distinguishing feature of perimenopause is uncertainty. You don't know. So one cycle, it might be totally normal, like everything's fine. And then the next cycle, it's really short, typically really short because you haven't ovulated. And then you might get a big gap. And then you get another period and it's really heavy. It's like really confusing, I have to be honest. But that's because the ovaries are a bit confused and the hormones are really varying. So menopause, that's easy. No periods, you're done and dusted. But it's this perimenopause, you might notice your periods are changing and you might notice those vasomotor symptoms I mentioned, the hot flushes, mood, anxiety, these sorts of things. And you haven't been in a traffic jam and whatever. This is really weird. What's going on? Just, you're feeling different. Things are different. And the periods are a little bit hit and miss. This probably is perimenopause. We don't advise doing a blood test in perimenopause. If you're over 45 and you're having the symptoms I've described, changeable cycles, mood, vasomotor symptoms, then we don't need a blood test because it's on symptoms. And actually a blood test could be misleading because we might do a blood test and we'll catch the ovaries on a good day. And they might be like, fine. And then you're going to be even more confused. You're like, my blood test says I'm fine, but I know I'm not. So it's actually not helpful. So that's really the main thing. The other thing I do want to say, Carolyn, is this is for a woman who is not on the contraceptive pill. That's even more challenging. So if you're having a menstrual cycle, then you can use that as the barometer, as I put it, barometer of what your hormones are doing. But let's say you're on the contraceptive pill, so you might be having a withdrawal bleed, but it's not a real period, if I can put it that way. Or you might be on the Mirena coil, which typically don't get any bleeding. So what happens in that case? So in that case, you haven't got that barometer of the menstrual cycle of the periods, but you do have all those symptoms will still show, by the way, the vasomotor symptoms and everything. So that's what you're going to be on the lookout for, okay? And your mood as well. That's really a crucial thing. Things don't quite seem right. I know it sounds a bit vague, but that's literally what it is. Perimenopause, it's that uncertainty, and it's a tricky one. But I do want to reassure women that perimenopause, in my opinion, is the most challenging time, because there's big, crazy fluctuations of the hormones. But once you're in calmer waters at menopause, it's like you know where you are, okay?
Yeah, and I think the other thing is it perimenopause? Is it I'm stressed and I've got things going on?
Yeah.
Is it mental health? And then of course they've got the other thing that potentially can sometimes be a crossover in exercise women, which is low energy availability. I've not been eating enough to fuel. I suppose for any student doctors who are listening, I suppose it's working all of those things out and trying to work out the person, if that makes sense.
Yes, you make a very good point, and I wrote about that in my book, because relative energy deficiency in sport is something I do a lot of work in and with. And you're right, it's the masters athlete, because people might think, oh, it's only someone in their 20s or 30s that can get RED, but no, absolutely not. I've seen it a lot in masters athletes, because it is a challenging time. Hormones are changing, you're getting frustrated, you don't seem to be progressing as you would like to, all this sort of thing. And so your body shape is changing. And so you can be tempted to restrict what you're eating, right? And then then you end up with REDs. And then that REDs often disrupts the menstrual cycle. How are we going to distinguish? So this would be a situation where I would do a blood test. I would do a blood test specifically for thyroid function, okay? Because the other thing is that underactive thyroid is much more common in women anyway. So it could be, and these symptoms of an underactive thyroid are an overlap with perimenopause, by the way, including disruption of the cycle. So in this case where I'm not sure, or I'm suspecting REDs or something, or a primary thyroid problem, I would definitely do full thyroid function, TSH, T4, T3. I know T3, before you say anything, I know T3 is really difficult to get on the NHS, but if you can lever it, it will be really helpful, because that's the primary indicator of REDs as per the IOC. So in this athlete that we're imagining, not sure, then I would, in this case, not do the female hormones necessarily, but I would definitely do the full thyroid function where possible, so we can see if there's something else masquerading.
And I think from my perspective, I've certainly had female masters athletes who have been cutting carbohydrate with regards to diet. And I need to be clear that I need to stay within my scope of practice because I'm a physiotherapist, but they've been cutting carbohydrate, which has actually had an impact, and their brain fog is worse because of that. I think there's an element, if you are an exercising person and you're doing any type of intensity, we do need to fuel for that exercise that you're doing. So just kind of obviously, because I keep these podcasts relatively short, and I obviously want to come on to all the work that you've done with regards to what you've published, etc. But HRT, now that could be a whole podcast in itself.
Wow.
But
in 1 minute HRT. Okay.
not 1 minute HRT, take as long as you like. But I think from my perspective, the first thing, is there any myths with regards to HRT that you're so sick of saying that you want to just go, please don't think this?
Yeah. Please don't think that if you take HRT, you're being weak and feeble. Right? And I describe in the book that it's a bit like Scylla and Charybdis, the two sort of equally evil things, a monster and a whirlpool, that Odysseus had to navigate between. And that's how HRT is often portrayed. There are those camps that say, no, you shouldn't touch it with a barge pole, don't go there. And others that say, you're crazy, take it and take a lot, and take testosterone, for goodness sake. It's, oh my goodness. So how do we navigate that? That's the first thing. And the other thing that hopefully we've now dispelled is that HRT causes breast cancer. Unfortunately, in women, by the way, the main cause of death in postmenopausal women is cardiovascular disease, not breast cancer, we should say. And it's true, there are unfortunately 23 cases of breast cancer in women per 1,000 women in the age group 50 to 59. And it's true that HRT, probably the more old-fashioned type, if I can put it that way, increases, there's an extra 4 cases. But this is the same as taking the contraceptive pill and the same as drinking a couple of units of alcohol per day. And this contrasts to the whopping increase, 24 extra cases if you're overweight. So you have to put things in perspective. If you are really struggling with the physical and mental things like we discussed, then actually HRT is a good option because it is licensed, regulated specifically to help you navigate HRT. And then after that, you can be discerning the type of HRT. And we know that taking estrogen through the skin, for example, gel or patch, and then there's something called micronized progesterone, which is exactly the same as the molecular structure and progesterone you produce yourself. So your body's, hey, great, I've got some more of the real stuff. So it can really literally change how you feel and so much better. And the other thing to say is there is no arbitrary limit to how long you should take it or can take it. It used to be said, oh, you only take it for 5 years, but that makes no sense. 5 years you're feeling better and then you stop it and you feel bad again. So the thing I really want to stress is it is every woman's individual choice, but I don't want a woman to think, oh no, I can't touch that because that means I'm weak and feeble, or that means I'm going to get breast cancer or anything like this. So don't let those are myths, okay? So you have to make your personal choice. And also the other thing is, why don't you try it? Always try to start at a really low dose. That's the crucial thing. Any medicine, we want to take the lowest effective dose. So start at a low dose and then see how you go. But give it 3 months, right? Because I have lovely women who give me a little message after a few days and say, I don't feel any better. No, 3 months. And also, to be clear, it's not the elixir of youth. You won't be a 21-year-old, let's be frank, but it will help you. It will potentially help you with really troublesome symptoms. So it's certainly worth exploring. With regard to testosterone, just to mention it, all women who've got a uterus, i.e. haven't had a hysterectomy, must take estrogen and progesterone together. And testosterone, if you're competing, it's on the WADA banned list, so don't go there. Okay, just to say, be aware of that. Yeah, do your homework and make that decision for yourself. Fortunately, most women, unless you've had a personal history of breast cancer, I've got a dear friend in my ballet class who sadly has gone through all that breast cancer and she can't take HRT. But for the vast majority, it's okay. And if you choose wisely and start with a low dose, it can be really helpful. And it will help you improve your sleep, improve the hot flushes. So now you've got more energy, so you can train. You can do that strength work. So it helps you get over that maybe what's holding you back from being able to do that strength training, etc.
I have to say, it's been absolutely amazing to talk to you today. Now, there'll be a lot of people who are listening and they're basically saying, I would really like to know more about this. What resources do you have that they can possibly go to?
I invite you to go and have a look at my books. Hormones, Health and Human Potential. It covers the whole lifespan, but as the name suggests, it's about hormones. And then just recently, The Myths of Menopause. It will go into a lot of detail of the stuff that we've been discussing today. And also the other thing to say is that I do offer individual virtual advisory appointments, okay? I call them advisory appointments because, of course, you must be registered with your GP. Because, for example, if after our discussion, the individual says, okay, I want to take HRT, then I would always advise to get it from your GP because you can get a prepaid prescription of HRT for just £19 a year. Wow. Bargain. Anyway, so that's the other thing. So yeah, have a look at my books. I've got a website, Nicky Keay Fitness, and yes, if you're thinking you really want to talk more in detail personally with me, then as I say, I offer this opportunity of virtual appointments, advisory appointments.
And there you have it. You can talk to the expert herself. If you have been affected by anything with regards to this podcast, please reach out to us. We can put you in touch with whoever it is that you need to talk to. And I will say to all of those of you who are working with masters female athletes who are a little bit older, please follow the evidence and please ensure you tune into our podcast the next time. We'll see you soon.
Thank you for listening to Women's Football Hub. The information within this podcast is for informational purposes only. No material on this podcast is intended to be a substitute for medical advice, diagnosis, or treatment. Please contact your doctor or another healthcare professional if you have any questions about anything raised in this podcast.